Of course, we welcome the fact that the Minister for Health has now published the report, but it does not absolve the government of the huge delay in relation to this report. And we would like to know from the government, of those recommendations, which ones they accept, which ones they reject, and those that are now included in the implementation plan. So we need a lot more oversight in relation to this report.
You say the government hasn't set out what it accepts, rejects or plans to implement, but there is a roadmap in place and they are going to conduct a survey. So isn't that what's needed?
Well, look, I think if you look at the words of the press conference that were used by the Minister when they talk about implementation plan and conducting a survey of mental health amongst patients in our community, isn't that the type of work that can be done, that could have been done in the last 19 months? And that's the point we're trying to make as an opposition. It is clear beyond peradventure, and if you look at the report itself, it is clear that there is no overarching policy by the government being directed by the government. Why is that the case? There is no suicide prevention plan in our community. There is no mental health budget in respect of our community. These are serious issues. There's a lack of coordinated leadership in respect to mental health. These are very serious, damning words in this report about mental health provision. And it's important for the government to acknowledge publicly that they're going to do something about those core issues, but also set out in fine detail this implementation plan. I would have expected this report to be published alongside the plan to demonstrate to the public and give confidence to the public that this plan is being dealt with and is being implemented, not just to publish a report that's been sat on a minister's desk for 19 months.
How do you suggest we start implementing some of these changes?
Well, it's quite clear. We need to integrate mental health as a very significant part of all of our health in our community. We also need to have a designated financial budget and responsibility for that, running through and identify what we're spending on. You know, the critical nature of this report about having no financial budget for the purposes of mental health is astonishing. Mm-hmm. The fact that there's no overarching policy of the government in relation to mental health is another astonishing fact. Why are we not ahead of the curve on this? And it is very surprising. Those are two significant points. A lack of coordinated leadership within our community on mental health. Those are things that we need to get right on the ground. And we encourage the government to publish this implementation plan so that we can all see it for our own good and the health of our community.
Mental health has long been an area that's been underfunded, under-resourced and lacked attention. And that's an issue that predates this administration. So isn't this an issue that would be benefited from a cross-party approach?
Well, so look, I entirely agree that if we can depoliticise mental health and work together as a government and opposition for the benefit of our community in installing mental health as an integral part of our health service, of course we would welcome that. That's, it's a fact. We are politicians as well as being human beings. We want to work together so that everyone has the quality of life that they deserve and the resources in our community to respond to the Cinderella of the health service as has been described in terms of mental health.